And so the impact of this unhinged nationalism and this America First global health strategy is that in Africa, we've had a decimation of HIV/AIDS, TB, malaria services.
You have institutions that have been key components in our regional sort of health and well-being, like the CDC, the Food and Drug Administration, the National Institutes of Health, being dismantled day in and day out right now.
And nationalism doesn't serve any particular public health strategy because diseases know no borders.
The National Institutes of Health, which is, I think, the largest funder of biomedical research in the world, essentially. I doubt we would have had the mRNA COVID vaccines, right? Hundreds of millions of dollars went into the development of those vaccines, and yet NIH is being dismantled as we speak.
Welcome to the Medicine and Science podcast from the BMJ. I'm Kamran Abbasi, Editor-in-Chief. While I've been away from the podcast, Donald Trump and his administration have been busy, unfortunately. From changing childhood vaccine schedules to bombing Iran, that's on top of the earlier withdrawal from the WHO, the cutting of all funding for mRNA vaccines, and a cross-border measles outbreak that stretched from Canada, the US, and into Mexico. What the American government is doing has implications for health and healthcare all around the world, and a recent article on BMJ.com has argued the consequences are so dire that the WHO should declare Trump and his administration as a public health emergency of international concern, which is what COVID-19 was. A big statement. I'm joined by two authors of that article to explain their thinking and what they hope it might achieve. We have with us Fatima Hassan and Matthew Herder. Welcome, Fatima and Matthew.
Great to be on the show.
Yeah, lovely to have you with us. So who'd like to explain why you think Trump and his administration should be declared a public health emergency of international concern?
It's really an array of actions. It began rather immediately when he returned to the White House in 2025 and announced the intention to withdraw from the World Health Organization.
Mm-hmm.
But quite consistently and systematically since then, they've taken a range of policy decisions to cut aid, even temporarily, but rather again and again for various global health programs that are responsible for providing treatment and services in many parts of Africa and other parts of the world as well, without which we're going to see a rise in infections. And as we got to talking as a group of authors about this what was happening, it became really evident to us, and I think lots of others who are on the ground, who were previously administering and providing healthcare to people in need with HIV and other diseases, that we're going to be facing a wave of epidemics rather soon. So we looked carefully at the law and we thought the threshold was met.
Okay. Fatima, would you like to add to that?
Yeah, thanks. My co-authors, Rujan, Andrew, Matthew, and I tried to set out the basis upon which we believe this constitutes an extraordinary event. And extraordinary event is relevant and useful because that's how it's defined in the international health regulations. And we've argued, as Matthews has indicated, that since assuming office up until today, April 2026, the actions of the US government and particularly President Trump and his team around public health pose a grave risk, not just for Americans, but for people outside of the US too. And so Matthews talked about the data that we've included on deaths and on new infections and around morbidity and mortality. And I can speak to that impact because I'm in one of the countries that's subjected to these funding cuts and facing the consequences of that. And it's quite dire at the moment. So the argument really is that the risk has been created through a set of actions which cumulatively together, we would argue, qualify as an extraordinary event under the regulations, and that would be sufficient grounds for the WHO to declare public health emergency of international concern. Now, it's somewhat controversial, or some people may say it's not feasible, because it's a set of political actions and funding decisions. It's not necessarily the outbreak of public health disease as yet, but the projections and the predictions are dire. And we would argue that in this particular case, it warrants, even though it's a set of political actions, it warrants the declaration of a public health emergency of international concern, or as some people commonly call it, a PHEIC.
Okay, so fake is kind of a interesting alliteration there. But I mean, you're using this as a device, really. I mean, let's say the pandemic, there were criteria. Those criteria had to be met. I get your point. I get your argument of the level of risk, but I mean, what are the criteria here?
Well, it has to be an extraordinary event, that's the actual phrase, that creates a potential risk of the international spread of disease. And so it doesn't have to be disease that is manifest right now, an outbreak that is real. It can be one that is forecast or imminent in some way. And it also is not tied to, some kind of particular outbreak. It can be the risk of disease that spreads internationally or is going to spread internationally, no matter the origin or source of that risk, right? So that's why it's much more open. Historically, this legal framework, it used to be called the International Sanitary Regulations, it was focused on discrete diseases, right? Yellow fever, cholera, those kinds of things, which were a concern and still are a concern. But over time, this regime has expanded, and it takes an all hazards approach, as we talk about in the article, which really opens it up. It hasn't been used that way to date, but people and other scholars, it's not just us, who've looked closely at how this mechanism has been used. There's always a political element to it. And in view of the terrible risks associated with the political actions of the US government, and in particular the president and his administration, we think it raises the question that this tool should be used in this case.
Okay. I can see where you're coming from. I guess the issue is, how do you implement something like this on a consistent level? So let's say, for argument's sake, Fatima, when you had those issues in South Africa around HIV treatment for HIV or prevention of HIV and drug therapy, etc. I mean, would that have constituted a fake, as you've described it? I mean, how would you apply this to other countries?
Yeah, I mean, I think that one of the criteria has to be, does this create global consequences and global impact? And we would, we've argued in the article that the actions of the US government and the administration is not confined to the consequences for public health, just for people living in the US, even though they're proclaiming that this is an America First public health strategy. But the consequences of those funding decisions by the US government since he took office, the combination of that with local policies that the US government is driving, and then it's, broad anti-vaccine and anti-childhood vaccination policy approach is having an impact, not just within the US, but basically everywhere around the world. So it's one of those cases where the actions of one government is affecting global health in the truest sense of global health, and it's affecting millions and millions of people, and it's affecting the policies of governments around the world who were in some cases wholly dependent on US funding for dealing with multiple diseases, including HIV/AIDS. You've mentioned measles. We're concerned about TB outbreaks and multiple other disease outbreaks as well. So I think I, as an HIV/AIDS activist, would argue that, yes, 20, 25 years ago, again, when US-based pharmaceutical corporations were denying us access to life-saving medicines, and it did have a massive impact in Africa, the HIV crisis was decimating us, yes, the WHO should have maybe acted differently. But I think right now, in this current moment, when we're facing this global backlash against science and against evidence, which is being driven by the US government in exchange, I might add, Kamran, for trade deals for mineral rights and for the right to have military bases, that there's a geopolitical element that we haven't seen before. It is unprecedented, and it creates a massive risk for public health and for the practice of public health. And that's why we would argue that this is different to other political decisions and actions that have, taken place before. I don't think we would have argued this, in the Trump's first term, but it's something that we definitely feel strongly about now that he's taken the reins of the White House in his second term. I mean, just yesterday, we saw in congressional hearings that even though the US Congress had set aside funds for PEPFAR, for example, the White House is still refusing to release those funds. The White House has also not asked for funding in next year's budget for important vaccination programs. It wants to gut Gavi, the Global Vaccine Initiative, and many other institutions. I think just, on those grounds alone, we think it's unprecedented and fits the definition of extraordinary event. So I hope I've sort of tried to explain how these sets of actions are different to what happened sort of a few decades ago.
Yeah, you made a point as just explaining that, Fatima, which was around why it should be described in this terminology. I just want to get something clear from you. I mean, one is a sense that the actions in the US are affecting other countries, many other countries around the world. I mean, obviously, I agree with you on that point and the harm that's doing. It's just thinking about this definition of a public health emergency of international concern. But you also then mentioned in relation to that some of the extractive processes or the trade deals that are being kind of, bargained, should we put it that way, with countries. Are you saying all of that put together, or was there one specific element of that? Is it the expansion beyond your own borders part of it that is particularly the concern here?
I think it's the combination, but I mean, Matthew, feel free to chime in, because it's, we've tried to argue in the paper that it's a set of actions that taken together meet the threshold of the definition of an extraordinary event, which has public health consequences globally. But Matthew?
Yeah, just add to that. I mean, it's the two things in tandem, right? By, on the one hand, withdrawing or reducing funding at every term for these global health programs. And then we were anticipating in writing up our argument that, the government might say, or the Trump administration might say, look, we have a global health strategy. We're entering all these bilateral deals. So it became important to explain at the same time as we're highlighting those cuts that they are extracting these economic and military benefits, whether it's critical minerals or some other thing that the government has prioritized, and literally holding hostage whatever little funding they will still make available for HIV or malaria, tuberculosis in those countries, unless you hand over those material goods that they're seeking to extract. So we have to take into account that they're sort of pretending to offer support on the one hand, when really they have an ulterior motive.
Okay, I mean, you've mentioned the international impact. Now, of course, your piece was very widely covered and very well read, and it's covered by Newsweek. Let's just read out what a White House spokesman said in response to the Newsweek coverage of your articles. This was included in the Newsweek article.
The World Health Organization knowingly and deliberately lied about COVID-19 at the outset of the pandemic, and is a key reason why many countries were caught off guard. Anyone insisting that withdrawing from this corrupt and incompetent institution will undermine our health apparatus does not know what they are talking about. The Trump administration remains committed to combating America's HIV epidemic. Instead of doubling down on a waste-ridden public health apparatus that has failed to deliver results, the Trump administration is retooling our health agencies to more efficiently fund promising research and effective clinical interventions. Throwing millions in government funding for projects to house HIV-positive transgender men with homeless women or study cocaine's impacts on HIV-positive people in Brazil doesn't move the needle on America's HIV epidemic. funding the Ryan White HIV/AIDS program, which has a 90% success rate with achieving viral suppression, does.
Okay, so Matthew and Fatima, so there are kind of three elements of that response. I mean, we don't need to dissect every line or every detail of that, but one is that actually it's kind of saying, no, it's not us, it's not the US government, it's not our policy, it's WHO that is actually the root of all these problems in global health. So that's one statement, and I think we've got Larry Gostin in a minute. We'll play him explaining what he thinks about that. He's an American expert in global health and in law as well. So we'll listen to Larry in a minute, but let me just detail these 3 points. The second one is about the fact that actually we're interested in America first. That's the second point. We care about America's health. And the third point is that clearly none of us will like this depiction of what projects are being funded. But the kind of broader point is that, by helping people abroad doesn't help people in the US. So let's just hear Larry Gostin from a previous podcast talk about the implications of WHO, of the USA pulling out of WHO.
Canceling out all U.S. funding of WHO, which is, roughly, 20% of its budget, hollow out the agency. In addition to that, Trump ordered in the same executive order a 90-day moratorium on all U.S. international assistance for health. And he's threatened PEPFAR, the Global Fund, the Gavi Alliance. So what's at stake is not just WHO's vibrancy and ability to act. It's also, the major global health programs in the world for AIDS, TB, malaria, just to name a few. There's going to be massive cuts and new regulations for sexual and reproductive health, which are necessary for the fight for STDs, HIV, and the like. So, all in all, the turning off a spigot of funding of U.S. participation at WHO and more globally would be an enormous vacuum. And I recently returned from Berlin, and I can tell you that European Union leaders, German leaders, French leaders, UK leaders who were at my meeting, there's no political appetite for those countries to step in and rescue WHO now because they're undergoing their own problems in every country.
Okay. Fatima, let's turn to you. Let's try and unpack some of this. What do you think of the arguments run there by the White House and the impact that's taking place in Africa and elsewhere where projects were supported with US money?
Thanks. I think that the only positive thing in the White House response to our article is they actually mentioned the words viral suppression. So that's quite unprecedented because, good to have the White House actually talk about that. The rest of it, I think, and as well as Trump's response to the reasons why he was cutting funding for the WHO or withdrawing, and his explanations since for cutting PEPFAR, USAID, CDC, NIH. I mean, the list is endless. The only way I can define that is it's just a form of unhinged nationalism for the purposes of political power. And I mean, we can go into the details and unpack sort of his own misunderstanding of the role of PEPFAR, the way in which this global first, America First global health strategy is being implemented to exclude populations at risk with a very particular right-wing nationalist agenda of public health. So the funding is not just funding cuts for diseases, disease management, or, for example, for HIV service. It's also about restricting support in public health services for people who are trans, for sex workers, for men who have sex with men, for other high-risk population groups. And so the impact of this unhinged nationalism and this America First Global Health Strategy is that in Africa, we've had a decimation of HIV/AIDS, TB, malaria services. Those countries that have been able to restart or reinitiate their programs in the last few months with limited funds from the US government, we've mentioned this before, have come off the back of a mineral deal or a military base concession. Or, and I think more importantly, and that's why we've argued it's an extraordinary event in terms of a public health risk, is that services will not be prioritized for at-risk populations. So you'll only provide funding for services that will cover young women or pregnant women, because apparently the US approach to public health now is to just look after pregnant women and not to be concerned about other at-risk population groups. Now, on a continent where a lot of high-risk groups are already criminalized, PEPFAR was the one place where you could access safe services for at-risk populations who were criminalized. In the absence of that funding, this means that these populations in these groups are in a double jeopardy situation because their own governments are not providing those services, nor is PEPFAR or the CDC or anybody else coming in. I mean, later in the podcast, we can talk about how this is impacting the rollout of Lenacapavir, which was meant to be this global revolutionary tool for HIV prevention, which again is being linked to this nationalistic agenda, extraction of concessions, and you know the desire of the US government and the Trump administration to yield political power through public health financing and public health policymaking. So all of that to say is that what an unhinged response from the White House to our article.
Yeah, well, let's talk about that example you just mentioned there, because I wrote about it as well in Editor's Choice just this week. I mean, you're pinning that on the Trump administration, which I can understand, but also the company itself is part of this, isn't it?
Yeah, definitely. And we've called that out. You know, in our view, Gilead is, for want of a better word, colluding with the US government at present to determine access, creating artificial scarcity throughout the world because it is being deferential to the US government and it doesn't want to, in inverted commas, get into trouble with the Trump administration. And this is why we're seeing a drip feed of supplies in Africa, very weird allocation of limited supplies to certain countries. And, you know, what I think is even more bizarre is you would have seen the World AIDS Day statement towards the end of last year, where the US government said, well, they were excluding South Africa from certain deliveries that were PEPFAR funded with Gilead because of our political position on a genocide, because of what they claim to be, which is, by the way, false or white genocide in South Africa. So, you know, all of the decisions around public health, around who needs access first, around the amount of doses you can access is being determined by the political priorities of the US government. And Gilead is, you know, willingly participating in this very absurd scenario that we have where the US government is telling Gilead and telling the Global Fund and others who will get supplies, when they will get it, and in what quantities.
So as far as my understanding of it was when I looked into this, the issue is that there is low cost supply at low cost of this drug, which is, you know, trials demonstrate how effective it is, to sub-Saharan Africa and other countries and parts of the world in need that can't afford it at its list price in richer countries of $28,000 just about per head or something like that for a course per year. And then people in middle income countries cannot buy at the lower price. They also have to buy at the higher price. And as we know, 70% of the people in the world living in poverty live in middle income countries. So it's a pretty extreme example of how a company combined with political motivations can then lead to harm amongst people in need.
Exactly. And I think the what you're talking about is, I hope, Brazil, right? Which has inexplicably been excluded from the licensed territory for
Mm,
generic supplies by Gilead. So that's the argument we're trying to make in our paper, that this is not just having an impact on a handful of countries in sub-Saharan Africa. It's, entire continent of Africa, Latin America, Asia, North America. I mean,
mm,
the impact is so dire
yeah.
that it warrants an emergency international response of coordination of financing, and we would also argue um, compulsory licensing.
Yeah, I mean that was a very important argument you all made, and Matthew, I think also in your paper, I know Fatima, you were talking about the projected impact, but also you were talking about you know, the actual impact. We already know of impact, don't we, Matthew? Just
Yeah, on the ground, there's evidence of treatment disruption, which when you're talking about HIV and other infectious diseases, there are very predictable consequences. And in environments where there are not a lot of resources, right, there's a possibility of hospital wards being overwhelmed with new cases of infection and AIDS and so on. So the knock-on effects are very real, and we've seen the disruptions already. Those clinics that were operating with the benefit of those funds in the past, right, they have to let people go. They have to close the facility. You can't, even if the funds were magically resumed, they're not going to sort of recover. And so what we've seen is a very bleak picture, even with the early temporary freezes that the Trump administration put into place early in 2025. I did just want to come back to what Professor Gostin said, though, too.
yeah, do that.
I mean, he's quite right that the implications for WHO are devastating. But it's even bigger than that, as he said, right? There is a lack of political will amongst other countries to step in and help fill that void. And so, as Fatima said, we're seeing this unhinged nationalism, or this inward turn. My prime minister in Canada, got a lot of acclaim for talking about, what a mistake it is to think we're going to appease the hegemon and do a deal that will serve our interests. But
Mm,
until we start to see countries collaborate and work together more in view of this kind of existential threat we're facing globally, it remains to be seen how many people have to die, and that's really part of the point of our piece, right?
yeah,
I take the author of the rapid response that talked about this may not be the right tool for the job,
yeah.
but how do we get these countries to cooperate to stave off things? Because the entire global health architecture is under threat, right?
Okay,
So,
yeah. Yeah,
yeah,
I mean, let's come back to that rapid response that we received in a few moments. We'll play that, and then you can
sure.
respond in more detail on that. But I think it's an interesting point we're discussing now. Well, it's all fascinating. This is particularly, I think, potentially important, which is what does it mean for the global health architecture, really? Which is that we can take the analogy of what's happening with NATO, for example, in Europe,
Mhm.
which is because of the US's behavior, Europe is now thinking, well, we have to do things differently. In fact, in terms of geopolitics, the whole everybody's thinking, how do we now realign ourselves? What are the new relationships and partnerships and security arrangements we need to make, etc. And presumably there's an analogy in health, which is that yes, all right. So WHO was dependent on a large amount of funding from the US, but now WHO and everybody else working in global international health will have to do things differently and find another way of meeting the needs of the poorest people around the world, the people who need care, need treatments, but can't afford them. What do you think, Matthew? I mean, what might that look like?
Yeah. Well, what we're seeing globally, at least in the wealthier parts of the world, is this, all of this funding being reallocated in the name of defense and national security. And I'm incredibly concerned about what that will mean for, the world's most vulnerable, anywhere we're talking about. If we take a broad view of what security looks like and spending for security, we should be thinking about infectious diseases, right? We should be thinking about the social supports, housing, those kinds of basic necessities of life. Those things secure us and make the world in turn a safer place. So there's a lot that's up in the air right now, and I'm terribly worried, right? Just as in the US, the federal government here in Canada and lots of parts of Europe, they're moving money into the military bucket, and I understand that there are very real security threats in this very terrifying moment. But what makes us truly at risk in the longer term is people who are unhoused, people who are not well fed, people who don't have access to medicines and healthcare more generally. So I really hope that there's some thoughtful decision making on how we deploy those resources in the places that have the benefit and the wealth to redistribute and avoid harm.
Yeah, but as you precisely say, the fact is, unless we address issues of poverty, and unless we improve the welfare and livelihoods in countries all around the world, then you will the opposite will feed more and more conflict. So I mean, it's never ending. Can we just turn to the US? And I mean, I know you're not in the US, but I mean, you could perhaps shed some light on this. And one element of clearly there's the international component of these actions, but clearly there's immense damage being done to US science, US healthcare, which of course has become increasingly politicized as a result. Of course, to these actions there is a reaction, and one of the lines of attack has been obviously around vaccinations, and it's quite interesting that today we're speaking on a day where the COVID inquiry in the UK pronounced that vaccinations saved about 500,000 lives. Okay, I mean, people may disagree with that estimate, but let's take that estimate at face value. And on the opposite side, you've got the anti-vax movement, which has really come to the fore. And a lot of the people that were very opposed to the kind of interventions that were achieved remarkably, like vaccination during the pandemic, are now in political power when it comes to health in the US, one of those being Robert F. Kennedy Jr. And that's caused disruption within US organizations, health organizations, organizations that run health and science in the US, like the CDC. Let's hear Bernie Sanders, who's obviously a critic of what Trump and his people are doing, talking about some disruption at the CDC.
Why did you believe it was so important for you to refuse to rubber stamp vaccine recommendations without seeing them or the evidence behind them? What did you fear was the worst case scenario if you had agreed to doing that?
I refuse to do it because I have built a career on scientific integrity. And my worst fear was that I would then be in a position of approving something that would reduce access of life-saving vaccines to children and others who need them.
And what is your concern? What are the long-term implications for the well-being of our kids and the future of our country if faith in vaccine science is undermined?
I believe preventable diseases will return. And I believe that we will have our children harmed for things that we know they do not need to be harmed by. Polio, measles, diphtheria, whooping cough. I worry about the ramifications for those children in illness and in death. I worry about our school systems. I worry about our medical institutions having to take care of sick kids that could have been prevented by effective and safe vaccines. I worry about the future of trust in public health.
Well, I think that very neatly captures some of the hazards. Matthew, how does it feel in North America with all of this going on?
Incredibly unsafe, and you have institutions that have been key components in our regional sort of health and well-being, like the CDC, the Food and Drug Administration, the National Institutes of Health, being dismantled day in and day out right now. And countries like mine depend in part on those institutions doing their work well, and their mandates and the people working inside them are being completely undermined by political interests that have very little to do with the evidence behind the interventions we're talking about. Yeah.
Okay, well, I mean, I think we'll see the full impact of what's happening when, in future years, people look back and are able to analyze the data comprehensively. But the signals are already there. And if we think about, let's take resurgence of measles, for example. I mean, that's alarming. However, I'm not to diminish it in any way whatsoever. When you look at the numbers that are in Canada, in the US, UK, Mexico, they are small when you compare that to the impact that's taking place in Africa and Asia and in other places. Fatima, what's your view on that? I mean, clearly,
Yeah.
each country has to be alarmed. The US is right. We're right to be alarmed of what's happening in the US with the resurgence of measles, in the UK and Canada and elsewhere. But
Yep.
the impact is multiplied many times over in your continent, for example.
Yeah. So, I mean, three things. The first is that, it's reminiscent of what happened in COVID, right? And nationalism doesn't serve any particular public health strategy because diseases know no borders. So what happens in the US if there's a measles outbreak, whatever public health outbreaks are in the US or in North America, is then going to be transplanted into our parts of the world. So there's a definite direct link, there's a causal link, there's a connection. And we saw that with the different variants that we had to deal with during the COVID crisis. And that's why we've argued that this America First health strategy is self-defeating from a public health point of view. The second thing is that what's really disturbing to hear in that particular clip with Bernie Sanders is that it's clear for everyone to see that there's a deliberate strategy to decimate the public health infrastructure, not just the institutions, but the actual network of public health services in the US. And that particular logic and approach has been for some time, but is now more forcefully being transplanted into our continent. And so we're seeing a resurgence and a rise of anti-vaccine movements, for example, in Africa, anti-termination groups that are being formed, supported by right-wing forces in the US. So the decimation of American institutional capacity, of their knowledge, of their resources, something that we would historically rely on, I think is a concern, not just for Americans, but for people in my part of the world as well. And I say that having firsthand experienced quackery or anti-science of our own president during the HIV/AIDS crisis. And, for anybody to say that what happens in one country doesn't affect another, I think that's quite a naive approach to it. So we are concerned for Americans. I mean, this is not just a concern that has a self-interest. And so that's why we've argued in the article, finally, the third point, is that irrespective of whether the WHO declares this a fake, we still all have to call this out for what it is. And the US government currently, and the Trump administration, we've argued in our paper, are the worst public health emergency crisis in the world right now. And that's what we're facing. And I think this clip by the former CDC director, amplifies that message, and I think gives credence to that message that we're dealing with a really unprecedented, unhinged, nationalistic movement that is affecting public health, not just in the US, but around the world.
Just to add to that, if I may, and the question of scale. So, of course, measles is not comparable to what's already happening on the African continent and elsewhere in light of these cuts. But, the way in which the National Institutes of Health, which is, I think, the largest funder of biomedical research in the world, essentially, I doubt we would have had the mRNA COVID vaccines, right? Hundreds of millions of dollars went into the development of those vaccines before COVID was recognized. And so we wouldn't have had some of the most effective interventions. And so and yet NIH is being dismantled as we speak in terms of actually doing R&D. They're not touching mRNA anymore. And what happens when we have a new outbreak of some kind that platform might be useful for?
I mean, if we had one now, I think we'd
Mm.
Yeah.
But there's
the
also
impact would be horrendous. Yeah.
there's also
Fatima.
adding to what Matthew's saying is that we're not just talking about the cuts to funding of services in Africa and elsewhere in the global south. It was also for clinical research. One of the most important HIV prevention trials was cut sort of in the early stages because of the CDC funding cuts. So the research agenda has been affected for multiple diseases. The ability of the world to respond to multiple outbreaks at the same time, if you have multiple disease outbreaks simultaneously, being able to diagnose, being able to treat, being able to deter that is going to be a significant burden, which is why it makes no sense for governments in the global north and global south not to be urgently meeting and figuring out, well, how do you pursue an international cooperation framework that is not extractive and that is not totally dependent on the US government? Because I think the sinister part of these funding cuts, which is why we've argued it's an extraordinary event, is it wasn't just a nationalism which said we're cutting your funding and goodbye, this relationship is over. No, they reappeared and they've re-emerged, and it's now conditional funding for certain programs, for certain populations with certain demands. So, it's a revolving door of sorts, and I don't think that governments in Africa are particularly prepared to be able to deal with this geopolitical reality. And of course we want self-reliance. Of course we want African governments to fund their own services and our own programs. But the manner in which this happened, and I think it was deliberate, was to disrupt the entire global architecture, to disrupt the local domestic architecture for public health in the US as well, and to create so much chaos that it's impossible then for anybody really to effectively step up and try and respond in a meaningful way.
Yeah, I think that's very powerfully put. I mean, your whole piece is powerful, and it forces people to think very starkly about the impact of the policies that Donald Trump and his administration have given us over the last 18 months or so. Unfortunately, there's quite a long time left. But not everybody agrees, of course. Let's hear this rapid respondent.
Hi, my name's James. I'm a public health doctor. I've studied and also worked in international development, and I'm currently working in public health medicine in Australia. My question is about international law and how it informs cooperation in global health. Reading the piece, I thought the authors did a nice job of outlining the legal mechanism and reasons for declaring a public health emergency, but I was wondering about the cooperation side. To me, international law doesn't necessarily drive cooperation in the international space, but cooperation really dictates international law. So I was curious, does discussing a public health emergency in isolation of this broader political process risk oversimplifying it?
And Fatima.
Thanks.
So what's your response, Matthew and Fatima, to that?
Yeah, I mean, I take the author's point, right? It's not clear that this kind of instrument will create that cooperation. That's upon the powers that be in other countries to actually do the work of cooperation. Our view is, okay, fine, but how might you start to motivate that kind of work? And we're not seeing it, is the sad reality, to the scale we need to, given the risks involved. So our paper is really a provocation and a call to action, which we hope will give this tool and possibly others, right? Using compulsory licensing is not contingent on there being a PHEIC declaration in the first place. You can go ahead and take those steps without it, provided a public health emergency exists in a given context. But it's not tied to this part of international law in any specific way. So this is one way to hopefully motivate that kind of cooperation. We'd love to hear other ideas about how to do that, but we want to draw attention to the need for it, given the scale of the harms that we are already seeing and will see in the future.
Fatima, let's hear a final comment from you.
So thanks, great question. There's three aspects that we wanted to emphasize, which we've included in our paper, about what a declaration could prompt. One was international cooperation and mobilization of resources in kind. The second was a mobilization of financial resources to deal with the pressing impact of the cuts and the decimation of services globally. And the third was to actually give the ability to global South governments in particular to take state action against a number of companies in the form of compulsory licenses for key medicines, so that countries that are poor, countries that were heavily dependent on PEPFAR funding or USAID, could basically get those medicines in for their people at a much cheaper rate. And I think the Gilead example is a prime example of why compulsory licensing and state action is necessary. Now, if that can happen in the absence of a PHEIC, great. But I think a PHEIC is just one of many tools that can actually force governments to sit around the table and try and figure out a response, given what we've argued in the paper, that there's a political motivation to this particular strategy. It's not just a public health response. And so I think, actually, ironically, the question talks about that we can't argue this in the absence of recognizing there's a political reality. That's what the paper tries to do. It's arguing that for the first time, consider a set of political actions that have public health consequences to be a public health emergency of international concern, that the set of political actions actually constitute this extraordinary event under the regulations.
Okay, listen, those three, I mean, you put three asks there pretty clearly, and personally, I agree with them. I have a lot of sympathy for what you're arguing for, and there's a lot of sense in that. The reality, though, is that we're a long way from being anywhere near to anybody offering those, even one of those. So finally, Matthew and Fatima, we're here with your paper saying we need to think about things differently, and here's a way to think about them. How do we move forward from here and get closer to where you want to get to?
I just keep coming back to the basic thought of, if not now, when. There is an incredible amount of harm that's already underway. And so we need to be thinking outside the box. Yes, public health emergencies of international concern have only been invoked in the face of an outbreak that's already underway, and in some cases too slowly, to be quite frank. So we were skeptical, and if you ask me what I really thought, I don't expect the World Health Organization to do this, but I think member states should be pushing it to think about it, given the stakes. And in the absence of that kind of leadership, WHO is very fragile. States need to be thinking with regional partners about what steps they can take, including in-kind cooperation, material contributions to each other's public health services and responses to outbreaks, as well as measures like compulsory licensing. So if it isn't happening at the global level, then regional actors need to come together in a way that we have yet to see, but the circumstances demand.
Fatima.
So the data doesn't lie. The data is saying to us that since the US administration changed its policy and implemented its funding cuts, that there have been considerable number of deaths around the world. There's some reports indicating 500,000, some reports indicating 700,000. So the number is significant. And then there's additional data coming out in reports that are showing that the projected impact of the US government's actions, the set of actions that we've described in the paper and the funding cuts, is going to cause new disease outbreaks and new infections, particularly in the field of HIV. So I think on those grounds alone, there needs to be a more forceful response from the WHO. I think its legitimacy is at stake. despite what the US backlash may be if they do make such a declaration. And I, echo what Matthew says, if not now, then when?
Okay. Thank you both very much for your time. We'll have to leave it there, and let's hope that the world's international organizations and countries can see sense, because, as you say, the data are already alarming and the projections are not just a decline, but a multiplication of the harms that we're seeing already. Thanks for your time, and thanks for raising this issue.
You're most
Thanks,
welcome.
everyone.
We're grateful for Matthew and Fatima for joining us today, and we talked a bit of geopolitics there. We in fact have a geopolitics call for papers out, which is entirely related to the issues we've been discussing. Generally, we're looking for all sorts of articles. So it could be an 800-word commentary in the form of an editorial or opinion piece, or even a 2,000-word analysis article interrogating the geopolitical determinants of global health. So if you're interested, get in touch and submit to the BMJ. We're keen for broad multidisciplinary perspectives targeted to a general medical audience, which is the target audience of the BMJ. Thanks for joining us for this podcast. We'll be back soon with the next episode. I'm Kamran Abbasi.